Mayor Bernadette Clément,
Présente.
Councillors Claude McIntosh,
Here in person.
Elaine McDonald,
Here.
Sid Gardner,
Here.
Dean Hollingsworth,
Present.
Caroline Hébert,
Présente.
Maurice Dupel,
Present on conference call.
Glen Grant,
Present.
Todd Bennett,
Present.
Justin Towndell, Councillor Justin Towndell. He was on the line, we may have lost him. Councillor Eric Bergeron,
Present.
Here. All right, I will start by acknowledging that we are gathering on the traditional territory of the Mohawk people of Akwesasne. And I'd like to welcome everybody. It's been a while since I've seen people in person, and it's good to see those of you who are here and hear those of you on the phone. So, a lot of us have been hearing the same thing. We are in this together, right? And yet we are urging everyone to be apart. So it is a difficult and strange time. But I think we're working our way through that. I don't know about you, but I spend a lot of my days on Zoom meetings and teleconference calls, and then I spend much of my lunch hour with the premiers, Premier Legault, Premier Ford, the premiers from all across Canada, learning a lot of lessons in good communications. I am very proud to be in Ontario and to be in Canada at this time. It's National Caregiver Day, so it feels like the right time to start off this meeting with words of gratitude to the workers whose devotion and professionalism is really impressive and brings care and comfort to us all. I'm also grateful to all of those who are following the rules, who are encouraging others to do so, who are informing themselves of all the changes that are going on, and for all of the folks who are providing essential services to our community. And I want to, before handing it over to the CAO, I want to assure everyone that administration and council and mayor are all working together in ways that are innovative and creative, but also very confident in the way that we're moving forward, also very well organized. So I want the community to know that everyone is working at a very high level throughout this process. All right. The agenda is being presented for adoption as presented. I suppose that we're calling for a motion to do so. Councillor McIntosh and Councillor McDonald, all in favor? Thank you. Thank you. Thank you for that. I just heard a voice from the telephone. So I'm going to ask the clerk to remind me whenever I'm, forgetting that there are all those people on the phones, remind me to go to the phones. I'm going to ask people as well to speak clearly into their mics. I think for the purposes of these meetings, it might be best not to stand. I know our usual process is to stand, but best to stay seated for those of us in the room. Speak into the mics. I will start with the people who are in the room if they have questions, and then I will go to the phones and canvass those on the phones to see if there are any questions from there. So I'll try and do that, and then ask the clerk to remind me if I forget.
if I may, Madam
Go ahead.
Mayor, is whenever one of our attendees on the phone is speaking, I'm going to ask them to identify themselves so that we know who's speaking.
Good. Thank you. So any disclosure of interest? Councillor Hébert.
Thank you, Madam Mayor. It's a little bit difficult because there's not a lot of detail on the agenda, but I do assume we will be speaking about the fund that social services will be distributing to community agencies. And I'm part of a few initiatives that will likely be applying for some of those dollars. So I will just step away when that comes up.
Okay.
Maybe I'll just roll back into the corner instead of leaving because
Yep.
there's limited space.
That's fine.
Madam Mayor?
Yes.
Councillor Ducal,
Thank you.
I would also like to, if we're going to speak about those dollars, I would like to also declare conflict as chair of the Admin Center.
Thank you, Councillor Duppel. Anybody else on the phone? Okay. Madam Clerk, you're fine with that?
I do, thank you.
Need a motion to go into Committee of the Whole. Councillor Hollingsworth and Councillor Bennett, all in favor?
Agree. Agree.
Thank-
Councilor Duval agrees.
Thank you.
Mayor agrees.
Thank you. And now we'll go to presentations and reports, and I'm going to turn it over to Madam Cieo.
Thank you, Madam Mayor. So this afternoon, we have brought in many of our senior managers. We have been having regular calls. We have daily calls as a team at 10:20 a.m. Joining us on those calls are all city departments, and it also includes Cornwall Police Services. The mayor also participates on those calls, and through those calls, we get daily updates with respect to things that are affecting departments, our departments that might be out in front line dealing with individuals in the community or caring for residents. And
Councilor Glen, I'm having a hard time hearing you, Maureen. So am I, since you're here.
Thank you for that.
Agree, Councilor.
no problem. What I'll try and do is I'll try and speak up a little bit more, so hopefully this is a little bit better for you. So we have daily meetings, and we go through a set agenda for all departments to provide updates regarding how the departments might be affected, things that we need to respond to. What we have planned for this afternoon's agenda, we have a list of our senior managers that will be presenting updates to council. We will allow councillors to ask any questions that they have. However, to try and mitigate how many people we have staying here in the building, once some of our managers are finished, they will be they'll be invited to leave the meeting if it's all right with council. If there are any items and we need to provide information to council following the meeting, we certainly will follow up. Not presenting tonight, we will not hear from the Cornwall Fire Service or from our General Manager of Infrastructure and Municipal Works. Those areas have minimal updates to provide to council, so we thought out of efficiency for the meeting, they have been excused from attending. And but we will have Cornwall Transit here this evening as well to speak. So with that, I'm going to hand it off to Mr. Geoff Clarke from Corporate Services to provide a brief update.
Thank you.
So, thank you. Can just to verify, the people on the phone can hear me adequately?
Very good, very, very
Okay.
clear, very well.
So just a bit of an update. So what we have, I'll be presenting, is a summary of the people that we had off due to illnesses that are regular illnesses, COVID-related illnesses, and family members that are affected and therefore affected by the self-isolation. So up to Monday, we had about 112 people off in one of those various forms of leave. 74 of them returned to work on Monday. And we have an outstanding of approximately 30. And I'm saying approximately, not that we're guessing, but it's fluid just based on shift timings and whatnot of how people are reporting into us. And if I could add that number 30 isn't outside of what we would normally have in any given day. So we're not seeing an exceptional spike due to the space that we're in. It's probably a little bit higher, I will say that, but it's not well outside the scope of what has traditionally happened. So to this point, our crossing guards have been laid off, but they are normally laid off due to the March break and then recalled. But with us not having a recall after the March break, they have remained off. The remaining use of casual or temporary employees have been redeployed within the corporation. At this point, they are assisting Mr. Golden with the lodge. As of Monday, we normalized our work weeks back, and we brought everybody back on that were maybe working modified work weeks. We brought them back to a more sustained approach, and we have not had any issues brought up to us in the last couple days as a result of doing that. So right now, outside of the recreational facilities being shuttered as they are, we have a number of things going on and behind the scenes, but we're actively using the people we have to do a number of things within the city as it stands right now. So we have currently planned what we have until the 20th of April, and in the next week or so, we'll be having to review where we are moving forward, and we'll be taking that decision as a group within the next week or so. So I would say that is all that I formally had to present, Madam Mayor.
Okay. Questions from the persons in the room first, and then we'll go to the phones. Councillor Abad?
Thank you, Madam Mayor. I have questions for staff who are not working in the office full-time. So for example, social services, they have staff coming in every second day because they can't have as many staff in the office. So for those who are at home, I'm assuming they're not working on their days at home. Are they being paid for those days when they are at home?
Yes, at this point, we are having people use leave or vacation in those instances.
And when they run out of that time?
We haven't crossed that bridge yet.
Okay.
Yep, Madam CEO?
Perhaps if I can just speak. So that was the case up until the end of last week. As of yesterday, all employees have returned to the workplace full-time. And there have been measures taken to provide adequate space and physical distancing to allow those employees to work continuously through now. Okay, and so leading up to last week, nobody was, I think, I'm going to put it back to Geoff, because I think that was just misunderstood
Yeah.
with the question.
Yeah, sorry, so thank you, yes. So as of now, they're back.
Okay,
The week
that's what-
before, they were not losing any pay. It was
Okay.
a straight,
Okay.
it was business as usual. They were just, working one out the next. And that's why part of the decision was, let's bring everybody back in and move forward in that way.
Okay,
And
so,
physical distance.
Physical distancing, yes, absolutely.
so this is the 100 and some that you were saying were not in the office, and now they are.
No,
Okay.
so that was so when I say the modified work week, in certain areas, because of it, they were offering a modified work week. The 112 that I am referencing were purely not at work for self-isolation reasons. And so this group coming back, some of which, like me having been one of them, we were working remotely. But others, it was not that, wasn't the self-isolation, it was just a protection to not having so many people in. And when we were here, that was the recognition that we could have people back with the appropriate distancing and safeguards in effect, and that's what happened on Monday.
And can you talk to us about some of those safeguards? Like, how are we doing that? How are we putting 50 people in one department?
So we take out tape measures. And funny enough, I don't mean to be flippant, but we did this room with 6 feet and measured off. So in each instance, working with the department heads, that they would have gone in and made those very assessments. For municipal works, let's say, they have a vehicle.
Right.
And you are responsible for the cleaning of it as you go into it and the cleaning of it as you go out of it. And therefore, we've put those in place. For municipal works, they're not often in that same congregated. They work in different spacings and whatnot, so it becomes manageable in that instance.
So then a workplace wouldn't be considered under the gatherings under, what is it, 5 now? I think we're,
No, I believe we're exempt for that
okay,
reason. Yeah.
okay.
Because they're essential, right?
They're
Yes,
essential.
yes.
Right. Okay. Great, thank you.
I'm sorry, I misunderstood and answered, and if I was
That's fine.
providing any ill clarity, my apologies.
Anybody else in the room? Questions for Mr. Clarke? Councillor McIntosh?
Jeff, when you talked about the 112 being off, was there one department affected more than any other?
Yes, the lodge has the most, and if I may add, we have had 8 people that we know that have been tested, and I'm sorry, Councillor McIntosh, you just triggered this. all 8 have come back negative. And the lodge is seeing the largest group as affected. And we were probably anticipating that. And a lot of it is, again, no confirmed cases. Some of it is sickness, a lot of it is family-related, some of it was self-isolation. But again, if they are symptomatic in any way, it is a firm, do not come here. And for the protection for obvious reasons, so that is why we were seeing the number as large as it is in that area.
Councillor Hollingsworth?
2 questions. Thank you, Your Worship. Question number 1, in some of the other departments where people are still working at home, and this might be to the CAO, I'm not sure who wants to handle it. Is it conceivable that they will run out of work?
Can't hear the question.
Oh, Councillor Hollingsworth, you need to speak into the mic, yeah.
Sorry, I thought I was loud enough. That being said, so the question is it conceivable that people who are working at home in whatever department, is it possible that they will run out of work? Like you have, you know, this report, like historically we would have reports to write and stuff like that. Well, if we're not doing any business in the city, those jobs aren't there anymore. Are we looking at a potential scenario where somebody might not have any work to do at home anymore? Is that
I'll start with the
possible?
CAO and then,
Thank you, Madam Mayor. So we do have several employees that are still working remotely, and I kind of want to come back to Councillor Hebert as well, because in those situations, the benefit of being able to have more employees work remotely provides us with more space for the jobs that are better done in our physical environments. People that are working remotely have access to equipment that basically is the same as the screen at their desk when they're in the office, right? So when I access my tablet at home, what I access on my tablet is exactly what I see when I'm sitting at my desk. So that remote logging in gives everybody access to the same systems, the same files, the same ability to do work. Overall, there are going to be some areas in the city right now where work volume might be a little bit quieter based on what is going on. We will continue to monitor that, but we're also sensitive to, we're ramping up and maybe needing resources in other areas when we're starting to look at how we might have to respond in the weeks ahead. So as an example, if we run out of suitable space in the community, we need space for lodging or people to recover or people to that might need access to shelter, right? Those are all things where we're going to need to provide some assistance, all hands on deck to help work on many of those projects, not just social services. So I think that we will see some areas where the volume will go down. I think that we're still a little ways away from that because there's still lots that people can be doing to get caught up on many things. But again, what we've been trying to do is monitor this in about a 2 or 3 week segment at a time. It also depends very heavily on what the province and decisions are made surrounding us with respect to what is closed, what is open, because we're also going to have to monitor heading into our spring and summer months, how is this going to affect other programming and facilities heading into the summer. So we're monitoring it, I think, week by week. But it's a good question, and I think it also depends on how long it goes on. If this goes on until the fall, then we're going to have to reevaluate this probably before that, right? But if it's still a few weeks, then I think there's ample work for people to continue on.
Okay. Thank you, Your Worship.
Mr. Clarke, anything to add?
I could add nothing else, other than my comments would have been if you can work remotely, you can work remotely. In the sense of, it's more, I would say, thought. If you have a computer, you can do it, you can do it wherever. The being here is part, I guess, of the social network.
Just as a follow-up, Your Worship, I was thinking in terms of building inspectors, for example. If construction stops, then building inspecting stops, right? So, and that's only one small, but if they're a building inspector and there's nothing to inspect,
Yeah.
kind of what do you do with them, right? And
Madam
thank
CEO,
you.
did you want to comment to that, or did you want, because I know Mr.
So-
Boileau's going to speak to that
Right,
as
so
well.
I think for something like that, what we can do is when Mr. Boileau comes up and he speaks about his area, there are some things like that that I think you can ask managers as to how their staff are working through, still meeting needs within the community.
Fair enough. Thank you.
Councillor McDonald.
Thank you, Madam Mayor. Within the field of social services, are we allowing any intake interviews? Are we facilitating that if people should obviously have a housing crisis?
Madam CEO?
So again, Madam Mayor, those questions, let's leave for the managers when they're coming up to, because they'll provide updates to council, so managers will be available to answer those questions.
Thank you.
Yep, Ms. Ferguson's number 6 on the list, so she'll be up soon. Okay, Councillor Bennett?
Oh.
No, okay. So I'll go to the phones and I'll go alphabetically. Councillor Bergeron?
Any questions in advance? Thank you.
Thank you. Councillor Gardner?
I have two letters that have been dropped off. One would be actually both to bylaw.
2, bylaw?
Is there any way, is there any way I can get those letters to bylaw? There's bylaw and there's another one is for James Fawcett.
Okay. Madam CEO?
So those could be brought to City Hall, and we'll make sure they're delivered to the departments.
It's not something that has to be done right away, but if there's anybody available, I'd like to drop them off.
Right, so you
If
should,
not, that's fine. I'll call the folks back. They left their phone numbers on the letter that they gave me and let them know that they'll have to wait like everybody else.
Mr. Clarke?
If I may, Madam Mayor, thank you. If, Counselor, if you'd like to bring it into the back of the building, we will make sure somebody's there to take the letter, because that's how we're sorting the mail through this process right now. So if you just let me know tomorrow, I will make sure I'm there to take it for you, and we can put those into the process.
Good. And the other comment I have is, sitting as chair of the Eastern Ontario Health Unit, I've been kept up to date on a daily basis with Dr. Paul, and a conference call yesterday with Dr. Paul. So if there's anybody that needs any information that is not getting from, say, you to mayor, or just call me, and I'd be glad to help you with the information that I receive from Dr. Paul.
Thank you, Councillor Gardner.
I have, thank you. Oh, one more question. PPEs, how are we doing with the equipment that we need? Glen stored on at the hospital, does anyone have that answer?
Yep. Madam CAO?
through you, Madam Mayor, we do have, I don't know if I want to say we have challenges with supplies. We do have supplies that we have on order and on back order. Some of our facilities have supplies that are going to run out in days, but then we're also getting deliveries as we work through these days as well. So it's a very good question. It's going to continue to be a challenge, I believe, for our organization as well as the hospital. I think we might have a couple of the managers can speak to that as well when they address council.
Thank you.
Councillor Dupel, I skipped over you there alphabetically.
That's all right. Thank you, Madam Mayor. Councilor Paul here. I just have a question. I realize that we've had it through our workplace, we're redeploying people to, say, the lodge. Under best practices and social distancing, is that something that we should be doing as a corporation? And I realize why we're doing it, but as a best practice, that's something we should be doing.
Madam CAO?
Well, through you, Madam Mayor, some of the resources that we're redeploying to the lodge are helping with areas of cleaning, laundry, a little bit of maintenance. And what that does is it allows relief to other employees that need to focus on primary care to residents. So by doing so, I think we've provided quite a bit of relief to the staffing pressures at the Glen, Stor and Lodge. And so I think that we do feel that it has been quite successful and it's worked well. Perhaps Mr. Clarke and even Mr. Golden, when he speaks, could speak to that. We are also recruiting right now for the Glen Lodge for some PSWs.
Mr. Clarke?
Thank you, Madam Mayor. The only thing I was going to add is, it wasn't, they were there, the people we redeployed were filling vacancies. So it wasn't that we had a complement of people that we added to, like we had a less than full complement of people that this group of employees helped fill the void in a difficult time to do any recruiting. So I hope that goes some distance in addressing Councillor DePel's concern, that it wasn't just adding people for the sake of adding it. They are fulfilling a position within the lodge that was not previously, it was previously vacant.
Councillor DePel?
It does address, and I think that maybe if we're somehow able to communicate that to the public, because what the feedback I've received is that we're adding more people to one location. So that reassures me, so thank you.
Thank you. Councillor Grant?
No questions at this time, but I just want to compliment the city and the team that's working on this terrible issue. I think we've been very proactive, probably more proactive than any other community that I watch this news every day and follow it, and I think we've been one of the most proactive communities around, and I compliment the team for all the action so far.
I'm smiling, Councillor Grant. Thank you for that. Much appreciated. Councillor Towndale? Councillor Towndale may no longer be on the line. So Councillor Towndale, just for everybody's information, was calling in from Borden. He's been deployed there and is going to try and continue to participate in our council meetings by telephone whenever possible. All right. I think we're on to the next person, Madam CAO.
Yes, we are. Thank you.
Thank you. Oh, Councillor McIntosh?
I overlooked this question. When it comes to hiring students, when does the drop dead point come when you say, okay, we're not going to be hiring any?
Mr. Clarke?
We have not made that decision yet. It is actively part of our look. So we posted all the positions as we normally would, thinking that it's better safe than sorry. But as part of this discussion, there are the decisions I've mentioned moving forward. That will be an active part of it. And much to the CAO's point, a lot of the recreation programs in our minds are tied to the school, or not the school board, but the province and how it goes about. If the schools are open, then maybe that is our cue that we could have programs that are opening as well. But right now, it's a holding pattern. We could enact it at any point. We do have the position, they were posted, we have applicants. It's now just a decision tree.
Okay. Councillor Mack?
Yeah, I'm fine.
Okay. Thank you, Mr. Clarke. Please
Thank
thank
you.
Mr. Donig as well for his work on this file.
If I may, Madam Mayor.
Go ahead.
I personally, I just commented on all this stuff, and I had nothing to do with it. As I was away and then self-isolated, Mr. Donig, Don Harvey, Aaron Harper, and Lori Del Greco deserve the credit for everything that I just spoke to. And I say that with no false humility. They put in a Herculean effort and deserve all the credit for, I think, for this being as smooth as it is. So I don't mean to take up council's time, but they really did the work. I had nothing to do with this. They truly, I've never been so proud to work with a group of people like I have through this.
Thank you for that.
Thank them for me, Geoff Sigard.
I will do that. Thank you very much.
Yep.
Actually, Mr. Donning's outside, and he probably hates the fact that I just said that.
Thank you.
Thank you.
I'm sorry to interrupt. Can I move the phone to a microphone?
Great
Yes.
idea.
Go ahead, Ms. Meldrum. Do whatever you need to make it easier.
I'd move it to maybe this side.
So for those on the phone, we are moving you closer to a microphone.
It's not 6 feet away.
I think
Emma?
this little piece needs to be over there, though, because I think that's a microphone for the
Yes.
speaker. Yeah, sorry.
Middle two.
Yeah, yeah. That's good.
Thank you for everyone's patience. So I'm going to welcome Mr. Bill Lister. Come on up, Chief Lister. Go ahead.
Hello. So Paramedic Services has been this kind of echoey here, so it'll take me a second to get used to it. Cornwall SDNG Paramedic Services has been extremely busy. We've been trying to address 3 goals. The first goal, which started quite some time ago, was to help contribute to slowing the spread. Whatever we could do to educate or help the health unit get that done, help the city help the health unit get that done, we were working on it. The second thing we're working on is continuing with core business and making plans so that we can do that in the days to come. And the third one is to protect the healthcare system. What we're trying to do in all of this is get ready for the surge. So we hear about flattening the curve all the time, which is surge, which means more people will be asking for help than we'll have resources to deal with it. So what we're trying to do is any plan or process so that not as many people call at the same time. So we're working on an astronomical number. It's a bit scary on what we have to accomplish, and we don't really know the exact number or when it will hit. We were told it would be in the next 3 weeks, 2 weeks ago. We haven't realized that yet. It's still the calm before the storm. Some people make the analogy that it's kind of like predicting a hurricane. You know it's coming, you don't know what coast it's going to hit. So we're working under that kind of premise. So what we're doing, so we're actively recruiting more paramedics to bring our complement of ambulances from its current 10 in the day, 6 at night, to 14. We have 4 spares that we use as mechanical replacements, and we're trying to increase that step by step. So starting this week, we've added 1 full ambulance to the road 24/7. We'll continue to do that until we run out of fleet. Fortunately for us, our 3 replacement ambulances that we ordered are in, so we're going to keep the old ones on the road and try and get radios put in the new ones, so we'll be able to go to as many as 17. I don't think we'll be able to staff 17, and 14 is our goal. So we're just going to try and, our first front is just put more ambulances on the road, see if we can keep ahead of the curve. The curve looks like about 7 added ambulances to the road to keep up with it, and that's a very loose prediction. It's very hard to nail this down. So that's a pretty good first step. The other thing we're doing is we're trying to prevent people from needing the hospital in the first place. So we're trying to get to the people who are not severely ill and set up treatment plans for them so that they stay in the hospital. This is kind of like the assessment centers where they make a determination whether you're sick enough to need a hospital or you go home and you stay. So our community paramedic program has been ramping up. Our program has increased 5-fold since we started this so that we can look after people in their house and not ever take them to the hospital. We're working on other things such as educating people on what the purpose of an ambulance is and when to call it, so that the sickest people get the ambulances when they need it. The less sick can either wait or find another means to get to the hospital or other service. We're working on new protocols where we can treat and defer, which is the newest thing the province has allowed us to do. This is where we arrive at a house, and instead of taking to the hospital, which we've traditionally always had to do, we have programs in place that we can start them treating in the household. Those are brand new. They'll start tomorrow. So we'll see how we do with that. We are protecting our workers. So environmental cleaning and hand washing, social distancing are all part of what's going on in our community to keep people safe. We participate with the health unit. We've been doing swabbing. This is where you take a sample from an individual who looks like they have COVID, and we help the health unit process. These are the people who traditionally can't get to a center of some sort, and we've been taking care of that for the health unit. We've done upwards of 11 in a day. We've been doing it for about 3 weeks now. The assessment centers have opened in our area, which helps take pressure off the hospitals by making a decision. It's triaging before they get to the hospital that says you're not sick enough for the hospital or you're too sick. You better get to the hospital. The hospitals have helped out themselves. They've increased bed capacity. They've postponed things like elective surgery. Nursing homes under the Act have been locked down, so we've got very little traffic out of the nursing homes. And the social distancing has caused pretty much every kind of accident to dry up. People aren't driving, people aren't riding bicycles, they're not falling off of roofs. So that has driven our call volume down, which is helpful. But our CP, our people, that's our community paramedics, are running off their feet. They're working really, really hard. The province has done a bunch of things to assist in what the task ahead is, and they've done things like the first one was they declared a provincial emergency. Specific to paramedic services, they've mandated a change in the screening processes. So our dispatch has to ask the questions, basically, do you have flu-like symptoms? They pre-warn the paramedic so that they can be ready before they arrive at the house. We have to do a end of bed assessment that's 2 meters away, and if they fail the screening test, we have to get into PPE. It's bound by law. The province has mandated what personal protection we need, which is the surgical mask, unless we're doing nebulized treatments, which is a bit controversial. You may have heard some of that. We've had some feedback that they feel underprotected with this. It's getting better with time. The province has also implemented self-isolation for paramedics or frontline workers who are symptomatic, which means they can't come to work if they have any kind of flu-like symptom, and they can't come to work for 14 days. So they're making sure that if you're incubating anything, you're well beyond it, so that the vulnerable populations that we serve aren't at risk by our own people. We have expedited access to lab work for frontline workers. So our turnaround time is about 24 to 36 hours for the from any paramedic that may be tested, and the results come back quite quickly. And as I mentioned, the treatment protocols are changing on a day-to-day basis, so it's a real challenge to keep up. Our call volume overall is down. We normally run around 50 calls a day. We're just barely hitting 40 calls. The trend is upwards though, which is making us a little bit nervous, and our COVID screening is almost every call now. So they're all testing negative, which means they have signs and symptoms of flu, but they don't have COVID. They don't have the novel virus. So there's a significant amount of sick people in the community, but we haven't seen the big upturn yet. So that's pretty much what we're working on.
Okay.
Thank you, Will.
Questions? I'll go to the people in the room first. Councillor Ibayo?
Just a comment, because we sit on the Joint Liaison Committee and hear a lot about paramedic services and a lot of keeping people out of hospitals that don't need to be in hospitals. So I'm always trying to find some silver lining in all of this horrible situation, and this treat and defer that you will now, as of tomorrow, be able to do. Maybe you'll be able to come back with some really great statistics after this is all done with this treat and defer process, because later on, you might be able to continue to use this instead of bringing someone to the hospital every time, right? Because that's always something that paramedics are trying to do, is to keep the stress off the healthcare system. So I'm glad that that's starting tomorrow, and maybe something that we can look forward to seeing later on in the future as a best practice.
Chief Lister?
The silver lining in all of this is the province is moving faster with change than they have ever moved before.
Yeah.
So things that we've been thinking about and contemplating over a long period of time, 10 years or longer, are actually happening. So they're actually moving in an action-oriented way. So that's a very positive thing. It's going to be a rough go.
Yeah.
We're well prepared, and there will be positive outcomes for years to come after this. So it's a lot of work, a lot of effort, but there will be some real gains when we're done.
Trying to point those out while we're struggling, right? Trying to see some positive in all of this negative.
Councillor Bennett?
Thank you. Did I see today there was a large donation of PPE made to paramedic services?
Yes, that's correct. It wasn't today, it was actually yesterday, but LCT, who we proctor a lot of their students, the college is closed early, and they had PPE available, and they phoned us and said, would you like to receive some of these N95 masks, face shields? This is a very precarious situation. The world has consumed all the PPE supplies. It's very difficult to get them. We're not in any situation where we're worried, but that was a contribution that really made us feel a lot better.
Excellent. Thank you.
Thank you. Anybody else in the room? Councillor Bergeron?
I have a question. I'm not sure if this is the right person to ask to, but since you brought up the hospital, a lot of doctors come in from Quebec. Is there an update on their access to Ontario, or what, I suppose?
So should that be for Chief Lister or Madam CIO?
Well, through you, Madam Mayor, we were on a conference call. We've been on a couple of conference calls with Dr. Paul.
It was yesterday.
I think it was yesterday.
With the MP and the MPP as well.
So I think that there were some, I guess there was some activity at the Quebec-Ontario border on the Quebec side, cautioning people traveling to our health system that we're working. And I believe that has been since alleviated, but I think in a community like ours, we are sensitive to understanding there's borders around us between provincial borders and international borders, and that might continue to be something that needs to be addressed by our MPs or MPPs and our medical officer of health and the city, depending. So I'm not sure if that really answers your question, but.
Councillor Bergeron?
It does. It does. I was on that call yesterday. I was just looking to see if there was an update. Thank you.
We are waiting for follow-up from the MPP in particular on that issue, and haven't heard back from him today, Councillor Bergeron. Councillor Duppel.
No, I'm good, thank you.
Councillor Gardner.
I'm good. Yep, I'm good, thank you.
Councillor Grant.
No questions. It's just a comment. I hope we've reached the peak, and we're not going to get to that peak. It's already gone past us, but that's wishful thinking. But again, compliments for the proactivity of your department.
Thank you.
Is Councillor Towndale there? Okay. Chief Lister, your paramedics and yourself are top of mind for all of us. You're at the center of the frontline service that we are thanking every day, and so you are definitely a priority for administration and this council. So thank you. Please tell your paramedics that all of you are in our thoughts all the time.
Thank you very much.
Thank you. Chief of Police, welcome, Chief Aikman.
Thank you, Your Worship. So good afternoon, everyone, and I'm quite pleased to come here and report on activities for the Cornwall Police Service. We're all learning a new skill in the Cornwall Police Service in regards to teleconferencing and remembering to put your phone on mute. I will admit to my dog barking this morning in the
Was
midst
that your
of a call.
dog?
It was,
Okay.
yeah. It's the squirrel in the backyard that caused the issue. So I have basically a rundown of what the Cornwall Police Service has been up to over the past month. In fact, I wanted to comment that we actually became operational February the 16th when notification of the quarantine at Nav Center became an issue. So that gave us a bit of a prelude into where we find ourselves today. This has evolved not only as a medical and health issue, but it is also an issue of civil disobedience and enforcement, primarily under two pieces of legislation, the Emergency Management Act for the Province of Ontario and the Quarantine Act from the Government of Canada. Two pieces of legislation that through my almost 40-year career in policing, I had had very little responsibility or been involved with in the past, but lo and behold, this past month I've read a lot more on those two pieces of legislation than I had ever knew existed. So on March the 17th, the Province of Ontario declared a state of emergency under the Emergency Management Act, and at that point issued two orders, and I won't go into the lengthy orders, but essentially we were closed bars and restaurants and also banned assembly of more than 50 people at that time. We, as the Cornwall Police Service, have the authority to enforce those orders under the Emergency Management Act, and there are some rather hefty fines that accompany those orders, as well as the ability to arrest individuals who obstruct an officer while enforcing those orders. So this is an ever-evolving situation, and the orders have evolved as well. As has been commented on by some of the earlier presenters, there is a daily change to the scenario that we find ourselves in, with new inputs coming at us daily. For those that have ever been involved in an emergency planning exercise, the creators of these exercises like to have little inputs to put twists on the scenario. There's a twist every day in this particular scenario, which is keeping us on our feet. March the 22nd, Dr. Paul issued an order closing daycares, churches, hairdressing salons, barbershops, etc., for his jurisdiction within the Eastern Ontario Health Unit. March the 25th, the Government of Canada imposed the mandatory 14-day isolation for travelers returning to Canada, and police have the authority under the Quarantine Act to enforce that isolation order. March the 26th, the City of Cornwall declared a municipal emergency. March the 27th, the province extended the enforcement of the Emergency Management Act to bylaw officers and special constables, and I want to point out that we've had tremendous cooperation with Mark Boileau and the CAO and the city bylaw personnel in regards to assisting with responding to calls under the Emergency Measures Act. We've divided the calls between the less than serious and those that involve retail locations, and the bylaw officers, as of yesterday, began assisting us in that regards. Much appreciated. April the 3rd, the province expanded the list of business closures and further reduced public assemblies and gatherings to 5 persons or less. Dr. Paul on the same day also issued local orders requiring retail stores to enforce physical distancing and social distancing and crowd control measures, and requiring persons with COVID-19 or COVID-19-like symptoms to isolate at home. All of these orders that Dr. Paul has issued, the Cornwall Police Service has the authority to enforce as well. As I mentioned, we began our operation essentially in February with the NAV Center. It gave us a little bit of a lead in regards to the acquisition of PPE equipment. So we had a supply on hand when the COVID-19 crisis actually arose. We do, however, continue in our efforts to secure more PPE like the rest of the world, and in order to ensure that our officers are well protected when responding to calls for service where people may be displaying COVID-19-like symptoms. Before an officer is dispatched to a call for service, our dispatchers ask a series of screening questions. We don't always get appropriate responses from the members of the public, but our officers are trained on how to use the PPE effectively, and they continue to do so. The province of Ontario, through the Ministry of Solicitor General, is assuming responsibility for the further acquisition of PPE. We participate in a weekly survey from the province in regards to our current supply, and we have not yet been informed in regards to whether the province thinks we have enough on hand or whether they think that we need more, and we hope to hear something this week in that regards. In regards to how we've responded as a police service, I characterize it as significant social and physical distancing measures have been implemented within the Cornwall Police Service. We closed our East End station at 330 Montreal Road and deployed the resources that worked out of that location to community patrol, with the exception of our vulnerable sector officer who continues to work with mental health challenges within the community. Unfortunately, her nursing partner is not able to go on the road with her. The hospital has chosen to keep the nurse within their facility, and that's understandable, but Constable Cameron continues to do her role in regards to vulnerable sector people. We have closed the lobby area at police headquarters at 340 Pitt Street. There is only very limited access to our lobby area, and before anyone is admitted, they are asked a series of screening questions. Our staff are required on a daily basis to take the online self-screening assessment tool, and if they are provided a response on the assessment tool, they are to inform their supervisor, and they are not allowed to come to work. I think we want to avoid the possibility of bringing COVID-19 within the workplace, which could effectively decimate our workplace very quickly. We are responding to non-emergency phone calls from the public by telephone. And as I mentioned earlier, screening questions are being asked of people before we respond to emergency calls for service. Most of our support staff have been deployed to work remotely. We're quite lucky to have already pre-existing IT infrastructure, which allowed us to use our own virtual private network to work remotely from home. So for the most part, our support staff are working from home. That's approximately 20 people. We do have a daily teleconference with our COVID-19 command team, which is made up of mostly senior leadership. We do take the opportunity to come into the station and be a visible presence, but for the most part, we are working remotely from home. As of April the 6th, the Cornwall Police Service has responded to 56 calls for service under the Emergency Management Act. One retail location was charged on the weekend for failing to comply with the orders of the Eastern Ontario Health Unit and was issued a rather significant fine. One matter is currently under investigation and has been referred to the Crown Attorney for advice in regards to the laying of charges, and that was one of the earlier events that gained a lot of social media attention. We've had a further 10 calls for service in regards to matters concerning the Quarantine Act, and no charges have been laid in that regards. Many of them have been in regards to RV vehicles parked in grocery store lots and things along those lines. Our direction from the Ministry of Solicitor General has been to emphasize education over enforcement, and that direction has been well explained to our officers, and they continue to comply with that particular direction. As the weather gets warmer and we see more and more people out on the streets, education may be set aside for enforcement, and that's a very likely eventuality. Our calls for service continue to be in the same range as they were before the COVID-19 crisis, somewhere in the 40 to 60 range, obviously busier on weekends. And we have directed our community patrol resources to increase police visibility within business areas that have been closed as a result of not being non-essential services. We recognize the possibility of increased criminal activity when there is no one around. So our community patrol officers are doing the best they can to make themselves visible and hopefully convince our criminal element to not be out and about. So subject to any questions from council, that's my report.
So, in the room, Councillor Hollingsworth?
Thank you, Your Worship. There has been, some people have articulated to me that there are certain retail, like grocery stores, who haven't obliged their patrons to stay within that 6-foot range, and that it's kind of, and you can guess which store I'm talking about, a bit of a free-for-all. Do we have any way of obliging those stores to adhere to that? Do we have any legal teeth to say you can't let like 300 people in the way you might have, say, 2 months ago?
I think Dr. Paul's orders are very specific in regards to crowd control measures, and they came into effect on April the 3rd. So a lot of the social media and the phone calls that we're all getting before April the 3rd, and in that one particular retail location that was mentioned quite often, we sent officers on the weekend into the stores to speak directly to management and to ensure that they are complying with the directions that Dr. Paul has issued.
Thank you. That being said, Your Worship, just a comment, if I might, on the enforcement versus education. I think if people are bound and determined to ignore the education part, I'm inclined to, okay, I'll lean right on them. If you're not going to do it, we'll save you in spite of yourself. Just my opinion. Thank you, Your Worship.
Thank you, Councillor Hollingsworth.
We'll take that under consideration.
Thank you, Chief Aikman. Anybody else in the room? Councillor Bennett.
Thank you. We spoke before the meeting, and I mentioned that you had an officer in the store making sure we're compliant with all the rules that have been put down. So
Can hardly hear you.
Nobody's ever said that to me before.
Lean into the mic.
So I was just saying that you had an officer in making sure we're following all the procedures. It was very much appreciated. You know, we sell bananas for a living. We don't necessarily know law very well. Some might think that these things are cut and dried and clear, but there's room for making mistakes, I guess. So it was comforting to have your task force in the store. I know they went to all the stores and point out what was missing or point out what we're doing well. So I thought that was really good. I would think most retailers by now probably have the message pretty clear, which is great. Just wanted to touch on park access. So, just to be clear, because I've had some strange conversations about what people can do in a park. If I'm reading everything correctly, a bike path through a park, no problem. Take your walk, ride your bike. But you can't go off park and sit at a bench
Right.
or go hiking through the forest. Like, this is,
Or
it's fairly clear, I think.
I think so. You can't use the equipment. We have had some calls of people using playground equipment, dispatched officers, and advised the children, and in a couple cases, adults, to move along.
That's good. I noticed in my area, the parks are all taped off, so I imagine that's Parks and Recs department. But I did notice today, driving around, the gazebo down by the boat launch. Is that supposed to be taped off, or is that supposed to be not in use? I'm just wondering who that falls under. Probably Mr. Boileau.
That would be Mr. Boileau.
Okay, well,
Yep,
we can wait till after, I guess, to touch on that.
sure.
Otherwise, I just want to say thanks. I appreciate what you guys are doing. I imagine the phone calls you're getting are crazy. But as somebody that works at a retailer, it was nice to have somebody come in and make sure that we were all on board, so
Right,
thanks.
thanks.
Councillor McIntosh and then Councillor McDonald.
The closing down of the Ontario Police College, does that affect your department in any way?
We had hoped to have 2 recruits in the May intake, and they've deferred the May intake. We're not sure when that is going to occur. So in the long run, it'll affect us. In the short term, no.
Thank you. Councillor McDonald?
Thank you. Madam Mayor, I want to pick up on something that Councillor Bennett said. I was going to save this question for later. I'm not sure who I would have addressed it to. But this whole question of walking, I understand absolutely no facilities, no benches, that sort of thing. But to go off a path and walk into a bush, what's the problem with that? You know what I mean? Like, I know I was walking in the city on Sunday, and every time I met somebody, the sidewalks are the worst thing. So either I or the other party, there were 3 parties that I encountered on my walk, one of us took the road. So it's very preferable, as far as I'm concerned, to walk in a big space like the St. Lawrence Park system, where you got a whole, I mean, I don't know how wide a car space is, 60 feet probably, and no vehicles allowed. So it seems to me walking on a roadway, or even in the park system, to walk across a park, what's the problem? It's probably better than walking on the path, isn't it? I mean, so if you depart from the actual bike path to walk on the green space, surely no problem, I hope?
Chief Aikman?
No, I don't think there's a problem with that.
Thank you.
I guess it boils down to the essential philosophy of staying home. And yes, it's we're being told it's acceptable to go for a walk with your dog in your neighborhood. But for example, if someone wanted to go for a walk at Gano Park, they had to hop in their car and drive to Gano Park, and I don't know that necessarily respects the direction that we're all being given, which is stay home. Going for casual rides in the car, there's nothing illegal about it, although I will tell you that if there's more than 5 people in a car and they're not family members, then there's something illegal about that. But I guess it depends. It's a two-edged sword. And I know this has been discussed on our morning EOC calls. We're fortunate in the community that we have not had widespread COVID-19. But, and I think that leads a false sense of security in the community. It is in our community, and it will be spread unless we stay at home. That's my philosophy.
I'm going to come back to that, Chief Aikman, but we're going to continue. Anybody else in the room?
I just like to add then, that some cities have actually opened up roadways to facilitate people walking, like no cars, for example. And I just throw that out there. Not asking for a thumbs up or thumbs down. I'm just saying it's been happening, because if people do walk, then it makes more room for distancing while you're walking.
Any comment, Chief Aikman?
I don't know that we have any roadways that would fit that bill. Lamrou Park is probably the biggest walking area that we have in the community. As long as people are walking and not using the equipment, we're not going to be enforcing anything.
Okay, thank you. So on the phones now, I'll go to Councillor DePel. Okay. I'll go to Councillor, Bergeron. Councillor Bergeron?
There was a beep
There was a beep.
earlier. Could we
All
have
right,
been
I'll go to
disconnected?
Councillor Gardner.
Maybe they all.
No, I
Did
think
we-
we were completely disconnected, yeah.
Oh,
Are they muted? No?
Councillor Grant, Councillor Towndale, anybody on the phones?
I think it was disconnected. Is there an email?
Welcome to the City of Cornwall's teleconferencing.
Please enter the... After the tone, say your name.
Is anybody on the line?
Thank you.
No, I don't think you're in the call yet.
Hello, is anybody on the line?
Councillor Hollingsworth?
Point of order, Your Worship. If we've lost our colleagues, do we have a quorum?
We do. Hello.
This is an
anybody on
update
the
meeting,
line?
and we're fine.
Yes, Councillor Bergeron is here.
Councilor Grant?
Sorry, I think we had lost the line for a moment, so we'll allow the mayor to continue.
So we were in conversation with Chief Aikman, and I will go to the phones now. Councillor Bergeron? Questions?
I was able to hear the conversation through the web broadcast. My questions have been asked as well.
Thank you. Councillor Dupel?
Madam Mayor, I think you pushed the easy button on that one. No, I was able to hear everything.
Good. Thank you. Councillor Gardner? Councillor Gardner? Councillor Grant?
No, I didn't hear anything after the Councillor Bennett started asking his question. It was just static from that point on. But anyway, if the questions are permanent, that I should hear them, then that's fine. But I just wanted to say, on behalf of the board, the police services have been doing a wonderful job, and I pass the compliments and the positive comments and support from the board to Chief Aikman.
Thank you for that.
Thank you.
Chief Aikman, do you want to comment on that?
No, thank you. I relayed your message, Councillor Grant, and we appreciate it. Thank you.
Is Councillor Towndale there? Councillor Gardner? Okay, you may want to check with Councillor Gardner as well. Okay, thank you. Chief Aikman, thank you for bringing up the NAV Center quarantine and reminding us how long some of us here have been on this particular COVID-19 file. I'd like you to thank Deputy Chief Spoward as well, who's been closely involved, and all of your personnel who are on the front lines. I want you to thank as well your communications person, Ms. McRae, doing a good job with video. You're doing a good job with video and sort of short form communications for people. I want to just quote, and I think it was the doctor, the chief medical officer of health for New Brunswick, who said, stop looking for loopholes, people. Stay home. And I know that that is difficult, that we are struggling with this idea that we need to stay home more. But the way that he explained it, and it sort of touches on what you said, Chief Aikman, about the more that we're in our cars, the more that there's a risk that there will be some socializing or some physical distancing or some friction that will cause the need for response from frontline. So we need to stop looking for loopholes.
Right.
All right?
I'm not a scientist, but as I understand it, the virus can only go from one person to another or from a surface to a person. If you don't come in contact with that other person or that surface, you're not going to get sick, and you're not going to make 2 other people sick.
Right. So, thank you for your comments. And I'll go back to your comment about education. We understand that the province is going with education first and enforcement next, but your points and the points from Councillor Hollingsworth are well taken. We will move to that piece as the weather gets better if people are not following the rules. And also getting information about the rules, because there's lots of information out there. So people need to take responsibility for informing themselves. I know that there's a lot, but a good place to start is the City of Cornwall website. Ms. Meldrum has done a great job putting everything there, and then it'll branch off to all of the different places that you want specific information for. So inform yourselves and stop looking for loopholes. All right? Thank you very much, Chief Aikman. Mr. Golden. Welcome.
Good. Thank you. Thank you. Greatly happy to be here. So for Glen Lodge, so before the province declared the state of emergency, we had already started to put preventative measures here at the lodge. So we started with daily meetings with the supervisors, registered staff to review infection prevention control measures, provide daily updates on residents' medical conditions, and also discuss new procedures and directives that we were receiving on a daily basis from the ministry as things evolved. The lodge had been closed to visitors since March 14th. All exterior doors as well as the lodge had been in lockdown since that date. And there has only been one point of entry, which is the main entrance. And there's designated person, staff that is at the main entrance from 5 a.m. to 10 p.m. at night that are screening all the people that are coming in. And access to the building can only be done with a swipe card, so if you don't have the secure card, you're not able to access the building. We also started to screen all visitors and staff on March 14th, along with taking the staff temperature. So again, we have a screening process. So all staff, when they come in, ask them the question, take the temperature. If they fail, they are sent back home. And visitors, the only one that we accept are essential visitors. So a resident that is critically ill or palliative care, again, they have to meet the criteria and they have to wear a mask in order to go up. If they pass and go up to the residents, there's only one person that is allowed to go see the resident, and they can only visit in the resident's room. They're not able to go in other areas of the home. We also delivery personnel, so all the stock that we receive, mail delivery and stuff like that, we also screen all these individuals as well. There's no more group activities occurring at the lodge, so it's only one-on-one socialization. We have a recreation staff that is there because as well we closed down our adult day away program. There's additional staff that we're pulling from that programming in order to provide more one-on-one with the residents. So we also, in order to promote the social distancing, we we have a new dining setup for the residents. So we added more tables to make sure that there's a bigger distance between residents when they're having their meals. We've added additional staff to be scheduled in order to ensure that if ever there was employees that were calling in with symptoms, we'd have additional support staff readily available. We also added at that time an additional housekeeper to touch high surfaces areas to make sure that it's clean. We also, at one point, had weekly staff meetings until March 26th, and moving after that, we went through communication via email. So on a weekly basis, I send a communication email to all staff telling them how everything, what's the updates and stuff like that. So they're very well aware for what's going on. We also are doing the same thing with the families, Meals on Wheels and adult day away programs. So we sent a bulletin on March 13th. And last Saturday, I've moved to electronic communication, and that communication is submitted to the power of attorney for care and substitute decision maker, and we ask the families to forward it on to other relatives in their home. So in regards to respiratory outbreak that we have at the lodge, so it's not something that is unusual. So usually respiratory outbreak occurs in fall and spring. So it's flu-like symptoms. So it started March 30th, 2020. To date, we have 5 residents that had symptoms, but that are not COVID. So whenever a resident has symptoms, respiratory symptoms, we swab them, send it to the lab. It takes roughly 48 hours to receive the results. All results came back negative. So when they do swab, they check for COVID, adenovirus, coronavirus, enterovirus, influenza A, B, and other types of virus as well. So everything came back negative. As of today, we have no new cases, and if things keeps moving well, by Saturday we will be out of outbreak. So as well, during that time, we started to take second temperature of the staff. So previously when we started, we were only taking temperature of the staff when they were coming in to work. Now we're doing it twice per shift, so to make sure that they don't develop symptoms while they're working, and if ever they would develop any symptoms, they're sent back home. Same thing with the residents. We are taking their temperature twice a day, looking at the symptoms, and if they have symptoms, they will be isolating them immediately and taking all precautionary measures. We also take daily information that is collected and submitted to the health unit. So we're working close collaboration with the health unit on the residents' cases and take their advice as well and recommendations. For our outreach program, so our adult day away program has been canceled since March 16th. And in order to minimize the isolation, we replaced it by a phone call to the clients to make sure that they're okay and safe. Meals on Wheels still being delivered, and we've received an influx of roughly 30% demand in meals, which is fantastic. We've added a new route 2 weeks ago, so this is fantastic. And there's been a demand on subsidized meals, which we're looking at options to tap into some funding for that. And in order to, Mr. Clarke talked about HR, and there was questions about staffing. So what we've done here at the lodge in order to make sure that we're adequately well staffed, so we reallocated some of our staff that works in other departments that were PSWs in the past. So we're using all these resources in order to make sure that we provide high quality care to our residents. We're also reviewing our staffing level complement to make sure that what are our minimums, that we can provide a safe, adequate level of care to the residents. We're getting the assistance from municipal work staff with non-direct care needs. And we're currently hiring PSWs and nursing students in order to assist us. So we had interviews last week and today. So in hopes to get new PSWs and nursing students in within the next week or so. And as for protective equipment, we have good supplies for the next 4 to 5 days. We're looking at, again, based on level of needs. So if we're not in outbreak, we won't need any PPEs anymore, but they're still available. We have to submit a daily submission to the ministry on electronically to tell them what's our level. If ever our levels fall low, well then they'll assist through that. And many PPEs, like any other department, are back ordered, but the Ministry of Health are prioritizing all the PPEs where the need is. And that's about it.
Thank you. Councillor McDonald.
Thank you, Madam Mayor, and I think your protocols are just exceptional. And I'm wondering, have you ever encountered somebody making a delivery who had a temperature?
No, we haven't.
Councillor McIntosh?
You're obviously following the Bob Cajun situation
Yes, we do.
closely as an
Yep.
administrator, up to 29 now.
Yeah.
The only way COVID-19 could get into your lodge would be somebody bringing it in, and you have a lockdown, so it would have to be a staffer, right?
If it comes in, yeah, it would have to be a
Yeah.
staff. So that's why there's rigorous systems in place where we ask all the questions when we start, and we've added as well an additional step to take the temperatures of staff.
You must come in every day with your fingers crossed.
I don't sleep, work 7 days a week, and don't sleep at night.
Anybody else in the room? Councillor Bergeron?
I'm good, thank you, Madam Mayor.
Councillor DePel?
Thank you, Madam Mayor. Through you to Mr. Golden, I was just wondering, I know that Ms. Meldrum is probably bombarded right now, but I'm just wondering, in light of everything that's going on, if maybe we could put out a communication to the community to receive some positive messages to residents who live in the lodge and staff, just because I've seen the great inspirational social media photos of people from the lodge, and I thought it would be nice if we invited our community to respond back.
I'm sure Ms. Meldrum can take a look at that. She is nodding her head and smiling, Councillor DePel. Okay,
Oh, great. Thank you.
thank you.
Thank you, Ms. Meldrum. Thank you, Madam Mayor.
Next up, Councillor Gardner. I think we may have lost Councillor Gardner. Councillor Grant?
I'm good.
Is Councillor Towndale there? Okay. Mr. Golden, as I indicated to Chief Lister and Chief Aikman, the Glen Stor Lodge is certainly, speaking personally, in my thoughts every day and night, and it is heartbreaking to see what has happened in Bob Cajun. At the same time, I've been lucky to be on these EOC calls every day, these emergency operation calls, and I know when Mr. Golden says he's working night and day and the staff are being super diligent, I know that to be true. So I'm getting some comfort in that, and I think, as Councillor DePel points out, we need to maybe push out that message, because I know I'm not the only one worrying about Glen Stor Lodge and you know, hoping that everything's going to be okay. I also have those same thoughts for all of our long-term care facilities in our area, not just the Glen Stor Lodge. I also know from having seen the Minister of Long-Term Care Facilities and the efforts that they're putting in, that this is a provincial priority. Long-term care facilities are a provincial priority. They are pouring resources and emphasis on all long-term care facilities, and Glen Stor Lodge is no exception. So I want to thank you. Merci pour ton travail. Je sais que tu travailles jour et nuit, et donc on apprécie beaucoup ce dévouement. Thank you.
Plaisir.
Okay, thank you. Mr. Len Tapp. Welcome, Len.
Good evening. So the update on Cornwall Transit is effective Monday, March 16th, we introduced a reduced service. It's approximately 70% of the normal service. It's what we're calling an enhanced Saturday service. So it's running from 6:15 to 10:15 and a 60-minute or 1-hour frequency, 10:15 to 6:15 in the evening, 30-minute frequency, and then 6:15 until the end of the night that we used to have was 11:45 is on-demand service. So people are calling in for that service, and we're picking up people as we see them when we're out in the community. Of course, it's bus stop to bus stop at that time. So in this enhanced service, we've made sure to include the Cornwall Business Park, because businesses are still operating basically the same as before this whole mess started. And we've also twinned each and every industrial route. So because the ridership was, we were trying to keep that social distancing on our buses. The new service also doesn't have community bus on Wednesdays or Saturdays. The ridership on community bus is averaging about 7 to 12 passengers a day. That's in a 5-hour period. The boardings on conventional bus are down to 800 to 50 to 900 Monday to Friday. Normally it was 2,700. And it's down on Saturdays from 450, 475, the normal 1,600 boardings. Handy Transit's averaging about 20 trips per day. The normal is 120 and 80 Monday to Friday and Saturdays respectively. We've started, of course, an enhanced sanitizing practices on our buses. Buses are cleaned daily or as needed. We switched to an Oxyver sanitizing product that's used in hospitals. TTC is using it also, and that's kind of where we got that one from. We had that product, but we didn't use it as often. Particular attention is paid to the driver's compartment and high usage area, common surfaces such as grab bars and doors, etc. We purchased and introduced an electrostatic sanitizing process. The unit uses a Clorox 360 total product. And the beauty of this unit is it charges the chemical product, the Clorox, and it doesn't just drop to the ground, it actually sticks to surfaces, so it'll go to all surfaces and sanitize those surfaces. This process is presently being completed twice a week, and we will increase that process as needed. All buses had 2 sanitizing dispensers installed on board, one in the front and one in the rear. Drivers have been supplied with Perel hand sanitizer and Lysol wipes. Latex gloves are available for all drivers. Face masks are allowed, but not encouraged. Drivers would have to supply their own masks if they feel that it's a safety issue. And of course, that policy is under review and going to go in line with the health unit's recommendations. Safety protocols for drivers, fares are not being collected, no transfers issued. March and April monthly bus passes will be honored in May or future months as things return to normal. Backdoor entry only, except for persons with mobility aids that need assistance. Caution tape has been placed from the front wheel well forward to isolate the drivers from the public. This provides the recommended 2-meter physical distancing practice. Safety protocols for passengers. Passengers are encouraged, and I really want to try to get this out to anybody who's listening out there. We encourage essential travel on Cornwall Transit only. And that includes grocery stores, banks, medical reasons, including pharmacies, and work. Signage has been placed on rear doors of the buses and inside the buses, informing passengers that if you have COVID-19 symptoms, not to board and to call the health line. The number is provided right on those signs. Cornwall Transit's policy is allow 8 passengers on the bus at any given time. Drivers may use their discretion, but must inform the shift supervisor when that maximum has been reached. An additional bus will be sent out as soon as possible to get any overload. Passengers should not travel in groups and should maintain a 2-meter physical distance when on the bus. We are exploring using the voice annunciation system to announce that transit is for essential service, to maintain physical distance, and do not approach the driver. Other things of interest, the maintenance department is staffed at 100% right now and continue to complete repairs to EMS vehicles, police vehicles, fire, and transit, both conventional and on March 16th, Cornwall Transit had a 25% driver absentee rate. That was before this really all started, and none were due to COVID-19. The reduced schedule helped manage the workforce situation. Some drivers have returned, but 2 others are off that are COVID related. One was tested yesterday, and she was told that she has a 5 to 8 day waiting period for the results. I've spoken to a lot about the drivers here, but the office and maintenance staff are also following physical distance practices and sanitizing protocols. Employee morale was shaky, to say the least, at the beginning, especially drivers. They were afraid, scared, but they're less afraid today due to sanitation and safety measures that were put in place. Also, due to the great support from the CAO, the GM, the HR manager, I think we've gotten over a hurdle with the driver's fears. And also, you know, we had to put in a new schedule, obviously, for the drivers, and this is collective agreement, so we had some great cooperations from the union to get this implemented. The other thing I'd have to say is I've had a lot of communications with other transit agencies, and the practices that we've implemented are standard throughout the industry. Pretty well my report.
Thank you. Councillor McIntosh.
The mask issue, I was reading in the Sarnia Observer where a driver who decided to wear a mask was taken off the bus, suspended. Maybe you're aware of the situation. I'm just wondering why no masks are out.
We're taking our direction from the health unit.
Yeah.
And that may be changing. It seems that the policy's changing a little bit, but when we implemented it, they were saying that when you use the mask, you had to use it properly, or else it could actually cause you some harm. Now, when I talk to my wife, she thinks that everybody should be wearing a mask, so I've lost that battle at home. But and we may see it further, you know, with drivers allowing to use the mask. We feel that they're isolated up in the front, so nobody's really getting near them. Handy Transit's a little bit different because it's a one-on-one. Some of the things we're doing on Handy Transit is, we're down to 20 calls. Most of those calls are going for dialysis. And most of those are coming from long-term care homes. And you just heard Mr. Golden talk about the protocols that they put in place. Well, all their nursing homes do that. So they're tested twice a day before they even leave and that sort of thing. So we're quite comfortable that they've been screened, if you will. The other ones coming from home, we have the coordinators phoning those people and asking them. We have a list of the 4 COVID questions, if you will, and they are asking those questions. Do you have a fever? Have you been out of town? Have you, respiratory problems? And what's the other one? Cough. So, I suppose they could lie to us, but we're giving the driver the last option, their discretion. If they're uncomfortable, they can contact the supervisor, and then we'll make a determination on whether that person rides or not.
A touch of irony here, going back to the Sarnia situation, where they're concerned because their ridership started going up after plunging, and the essential service thing comes up. They're afraid people are using the bus service and not for a non-essential business.
So we've had a bit of that because although we weren't advertising that it's a free fare, we couldn't collect fares from the back door, and people were coming out. But I think as we move along, that more people are getting the message, and there's just not that many places to travel to. So it's that's the other thing that's helping us out, I guess.
Anybody else in the room? Councillor Bergeron?
I'm good, thank you.
Councillor Dupel?
So I just have a question, Madam Mayor, through you. Whether a driver or not would ask for a mask or to use a mask, would the city be willing to provide the mask?
Mr. Tapp?
So at this time, no, we would not provide the mask, but we would not stop that driver from using their own mask.
Right. So what liability is on the city for not providing the PPE for someone directly involved with the community?
Mr. Tapp or Madam CAO?
Well, through you, Madam Mayor, I think if we're following the advice that we're getting from the medical health officer and the Ministry of Health and these provincial protocols, I don't believe that there's liability because the municipality is not acted in, I guess, an act of negligence. However, again, we are aware that things are changing day by day. So it doesn't mean that at some point in time, our decision to do that might change. And so again, we will monitor it. If it does change, we'll certainly let council know, but at some point it might change. And
Right. So I would feel more comfortable as a director for the corporation, as the employer, that if an employee felt that they wanted to use a PPE, I'm not sure why we would say no to that as a precaution.
through you, Madam Mayor, also too, there is a fairly significant supply issue with PPE. So that also has to be protected for those services that require that equipment. I think also Mr. Clarke might want to add some comments.
And then Mr. Tapp. Mr. Clarke?
Thank you, Madam Mayor. So I think specifically maybe to Councillor DePel's question, if somebody contacts this through the course of their work, it will become a WSIB issue. And WSIB has now established a protocol and questions and how these are to be related for that issue. Regarding the PPE element of the mask, as we understand it now, and again, in the face of the emerging data, we understand the mask to be the wearer not infecting others. It doesn't, in fact, protect going the other way, which has been our reliance on the public health, and all the prevailing data and education that we have to this point has led us in that way. We do continue to evolve as the situation evolves, but I only mention that, and again, in the hopes to provide a bit of insight and maybe just some comfort to the councillor's question.
Mr. Tapp?
And just further to that, well, I know that London has had work refusal by some bus drivers, and they're not providing masks. And when the Ministry of Labor investigated, all the procedures that I just mentioned that we were taking were being taken by London, and the issue is closed, and no further action was required.
Right, so thank you. And through you, Madam Mayor, to Mr. Tapp, so is our union in partnership with this, or are we having any kind of setback from that?
No, the union has been informed of the procedures that we've put into place as we've gone on. Just on Friday, the HR manager met with the union executive from ATU and informed them of all the procedures and asked them if they had any concerns moving forward. Some of the ones that they did bring up were already being taken care of. They're well aware of what's happening at other properties from their from other union sources and whatnot, and they seem to be quite content, if you will, to feel that they're being well protected. As a matter of fact, we were told that Cornwall was very proactive and ahead of many in the game, especially in the United States.
Well, that's great to hear, and I'm not working against us. I'm just asking the questions because I know that as frontline workers out there, there's so much information, as well as we all know. There's so much information that's coming through, and it's sort of overloading, and I just want to make sure that our employees are feeling comfortable with what they do in their task as an employee of the City of Cornwall.
Thank you, Councillor DePel. Councillor Gardner? Councillor Grant?
I'm good.
Councillor Towndale? Keep trying. Okay. Mr. Tapp, I'd just like to confirm to everybody that what has happened in transit is textbook good communication. Everybody has come to the table, union management, to talk about concerns early on, right from the beginning. And that has led to a very good level of comfort around this service, because you're hearing from all the people who have staff that are frontline. That's why transit is here, because they were right there from the very beginning and have worked through a lot of challenges. So I want you to thank all the drivers on behalf of Mayor and Council. They have been fantastic. On the issue of masks, that continues to be controversial. So Dr. Tam, our Chief Medical Officer of Health, has resisted for a while, saying that masks should be worn, to Mr. Clarke's point, because it is for those people who may not have symptoms or have symptoms and are to wear the mask to not transmit it to others. When you wear a mask, it's not automatically going to protect you. And one of the reasons around that is because when you're wearing a mask, you will be more likely to touch your face more often to adjust it. This is what Dr. Tam is talking to us about. So this is why it remains controversial. However, the CDC has said people should start wearing masks. So now in Canada, there is a shift. But we know that this is a rapidly evolving file. From hour to hour, the CAO and I look at each other and say, okay, that changed from 2 hours ago. So this continues, and to Councillor Duppel's point, we are watching this carefully, and we will see what happens with masks. But we're on it, and we'll definitely be ahead of that trend, as we have been in most instances. The City of Cornwall is doing pretty well there. So thank you, Mr. Tapp. Did we lose people on the phone? I just heard a beep.
No, we're here.
You're there? Thank you. Thank you, Mr. Tapp. Thank you.
No,
Councillor
Madam
Bath.
I just want to make a comment that maybe those on the phone could put their phones on mute while they're not speaking, because there's a lot of noises and then some feedback. We can hear you speaking through the microphone because they're hearing you. And anyways, I'm just making that comment if they're hearing me. And then just a comment, I did declare conflict on one item that will be presented by Ms. Ferguson, so I will step away for that, but I will come back to make comments on the rest of her presentation.
Thank you for that.
To step away for the whole thing.
Ms. Ferguson.
Thank you,
Welcome.
Madam Mayor. So I just wanted to speak to a number of new initiatives that are happening in the Social and Housing Services Department. The first is the new Social Services Relief Fund. So this fund was announced by the Ministry of Municipal Affairs and Housing in response to COVID. So the City of Cornwall has been allocated just over $4.3 million, which was very exciting, for the fiscal year of 2020 to 2021. So this fund must last 12 months. So I think that's really important for people to understand. And this is for Cornwall and SDNG. 50% of the funds will be dispersed in the next 2 weeks, and then as the months go on, it will be dispersed to the City of Cornwall after that. So the intention of the fund is to help municipalities and social
Sid Gardner is now in the conference.
Okay.
So the purpose of the fund is to help municipalities and social service providers, such as shelters, food banks, emergency services, social and supportive housing providers, charities, and other nonprofits continue to deliver those services to the community. As an example, it's not comprehensive, but food, lodging, cleaning services, communication, transportation, and PPE would all be eligible services under SSRF, SURF Fund. So in order to advise the community, I participated in a Zoom teleconference hosted by the Social Development Council as well as United Way under the Regional Emergency Response Council. And there were a number of nonprofit agencies throughout Cornwall and SDNG that participated in that call. I believe there was a representative from each sector on that call. The application is now live on the website in English. We're just waiting for a few technical issues with the French translation, but that should be up tomorrow. The application is open to community agencies until April 17th at this point in time, and I encourage all people that meet the criteria to apply for that fund. The second initiative is the community information line that's being housed at Social Services. The hours currently are Monday to Friday, 8:30 to 4:30. The number, again, although it has been plastered by the mayor and
say it again, Ms. Ferguson.
It's 613-933-6282, extension 3129. There are currently 4 staff on that call. on that line. We've received, as of yesterday, over 520 calls to that line from the community. The types of calls that we do receive are quite varied. However, there is a lot of calls about Ontario Works for people that have been laid off, that are looking for additional funding, or they need cleaning supplies, et cetera, because they have concerns in their own home. We do have receiving a lot of calls for municipal services, like what is the bus schedule, when are things reopening, am I allowed to go to the park, those type of questions. A lot of questions about the new provincial and federal government programs that are out. So for example, the employment insurance program, so I just dated myself there, and the new CERB benefit. Questions about the emergency childcare, and a lot of questions about COVID. So the symptoms of COVID, allowable businesses, business practices, and personal social distancing. So we do fend a lot of calls in that regard. And there are a number of questions for our CHIPPY program, so utility arrears, rent arrears, et cetera. The third program is the emergency childcare. So our application was launched March 31st. We have received 69 applications. Those spaces in those centers are reserved exclusively for children of essential and critical services workers identified in the province of Ontario's list of workers eligible for emergency childcare. We currently have 33 spaces, which changed from yesterday. It was 23 spaces yesterday, 33 spaces today. There are 20 spaces in Cornwall, 10 spaces in Chesterville, and 3 at a home childcare provider in Aikman. So there were protocols developed by the Eastern Ontario Health Unit that were provided to all of those providers for sanitization, screening protocols at the door, as well as allowable classroom protocols and guidelines. The last new initiative is through our Ontario Works Department. So there's 2 streams through our Ontario Works Department. One is for additional funding for our clients that are currently in receipt of Ontario Works. ODSP clients can apply through their ODSP case manager. So there are additional limited funds, which on a one-time basis for clients to assist with their emergency needs. So whether that be cleaning supplies or other items that they may need due to COVID. The second is that the Ministry of Community and Social Services is expanding the eligibility for one-time social assistance. So in terms of folks that may be waiting for unemployment insurance because their hours have decreased or they lost their jobs, or if they're pending the new Canada benefit, the CERB benefit, that they can come to social assistance and receive up to 48 days in social assistance. So it may help them transition through that period of waiting for those additional benefits. As of this morning, we'd only received an additional 27 applications for Ontario Works for people who had identified hardship due to COVID. So that's smaller than we anticipated at this time. So that's all I have to share at this moment.
Thank you. Questions in the room? Councillor McDonald.
Well, I did have a couple of questions, but I think you've answered them. I gather then you've got people on the phone, so you are doing intakes for housing applications and that sort of thing?
Correct. So through you, Madam Mayor, all our regular business continues. It's just not the public coming in. So all of our application processes still continue via the phone.
Okay. And then for these emergency funds, agencies can apply, and they're not necessarily government agencies. Like, for example, the Gappe Center would be able to apply too.
Yes, so as long as you're a nonprofit, you can apply, or a municipality can apply for these funds.
And then when the applications come in, who reads and approves or rejects them?
So we haven't gotten that far yet.
Okay.
But the funds, because they've been issued by the municipal MMAH, so the housing, that it will be processed through likely Melissa Morgan, sorry if you're listening, but it likely will be streamed through Melissa Morgan, and the approval process will be
Right.
worked out over the next week or two.
Yeah, very good. Thank you.
Any other questions in the room? Councillor Yabak?
I'm just glad to know that there's a little additional support for families on OW and ODSP. The same sort of extra support is there for them, because I know that a lot of these families usually have their kids in school. And a lot of these kids who are in school rely on breakfast programs and snack programs. and now that they're at home, there's additional costs to that. And so it's why we see in food banks an additional need for school snacks and food in the summertime. Food banks are dry in the summertime, and that's likely what we're going to be seeing now. And so that it's nice to have that a little additional support for families through Ontario Works and ODSP as well at this time, so that they can support some additional food for those kids while they are at home with their families.
Yes, thank you.
There have been many parents talking about having their kids at home all the time and having to spend extra money to entertain them, right? Looking at the CAO, because we've had obviously lots of conversations over the last few weeks. So when you're on OW or on ODSP, you don't have as much leeway around children and trying to make sure that you have enough or more for them to do at home. So that's a very good point, and people don't always realize that even when you're on OW, you're still getting your check, but you have added pressures like everybody else because of the pandemic. So thank you.
Agreed.
Anybody
Also,
else?
if I can,
Oh,
sorry, if
sure,
I
go
can
ahead.
add, Madam Mayor, there's also an additional GST check that will be sent out on the 9th of April.
Yes.
As well, the child tax credit will also be augmented by $300 per child per month.
Yeah, that's good news. Anybody else in the room? Councillor Bergeron?
No questions.
Councillor Dupel?
Thank you, Madam Mayor. I declare conflict.
Oh, yes, sorry. Thank you for reminding me. Councillor Gardner?
That's all right.
I'm good.
Councillor Grant?
I'm good.
Councillor Towndale? Okay. I would like to just publicly again thank Minister Clarke for this amount for our region, and remind, as Ms. Ferguson said, that it's not just for Cornwall, but we are the service managers for SDG. And so we will do our due diligence around that money. I like to hear you say that 50% of it is going to go out in the next 2 weeks, because the point is to make sure that the money goes out quickly, because the need is now. So I'm just very thankful to the ministry for highlighting Cornwall's need in that way. I'm hoping that the fund guidelines are also going to be on the website. So your application is going to go live. But all the guidelines around who, what, where are also going to be part of that process, right? For the fund, yeah.
We hadn't posted the guidelines because the guidelines, there is a guideline for this fund, but they also have to follow the CHIPI guidelines.
Okay.
So I'm not it may be complicated to extrapolate from the CHIPI guidelines what would apply to this fund as well, but I can speak with Ms. Morgan, and we can determine if there's something that we can come up with that organizations could ensure they understand the applications.
Well,
However, we have indicated on the application form that we will be following up with all the applicants, because it was very difficult to create a comprehensive application form for all of the different agencies throughout Cornwall and SDNG. So I believe there will be an in-person, a telephone contact with each applicant, so we can understand what their business needs are, but also that they can comply with the guidelines and the ministry requirements in terms of reporting and maintaining their receipts, et cetera.
Right.
And there will also be a funding agreement that each organization will have to sign. And inside that funding agreement, there will be specifics regarding those things as well.
Okay. So a lot of the questions now that I'm getting are, how do I qualify for that? Should I be applying for that? So it's pretty basic as to, they're trying to understand if they fit into that. So I'm just letting you know that that's a question that's coming up a lot. So whatever information, context information would be helpful now.
Okay, so maybe I'll try to find something that's maybe a little bit more descriptive of who should make an application. But if they're unclear, I would encourage them to apply.
Okay.
I'd
Good.
rather people apply and not qualify than people not apply that would have qualified.
Absolutely. And is that statement on the website with the application?
I'm going to turn to Ms. Meldrum.
Okay.
I don't believe so.
Okay.
No.
We should be making sure that that's the way that we want to proceed, is have people apply, and then we'll let you know.
Okay.
Thank you, Ms. Meldrum. Ms. Ferguson, I'll go to Councillor McDonald, who had her hand up. Go ahead.
Thank you. And this question might be directed to Ms. Meldrum as well as to Ms. Ferguson.
Go ahead.
When you began your presentation, you listed the types of questions you get, and they are literally all over the map. It's as though you're the general information. And I'm just wondering if Ms. Meldrum's experienced the same thing, or, like, I think it's really wonderful that, that people know there's a phone number that they can call and they can ask anything. Do we get the same, do you get the same sort of questions, Ms. Meldrum? Okay. The more the merrier.
Yeah.
That's great. Thank you.
So I will add to that, because I was just closing up with Ms. Ferguson, and I want to touch on that line, which I think is fantastic. Councillor Duppel mentioned there's information overload. So people, when I tell people, please inform yourselves, for some that works, for some that is just too overwhelming, and you need to have a phone line where you can talk to a person who's going to help. So the 4 people who staff that line, by the way, it's bilingual, so people can access that, French and English, are rock stars and are experts now on a lot of what's going on. So I'm very grateful to them, and I want all councillors to please talk to people about that phone line, because it also gives us a lot of data as to what we need for our community. And I also want to close with this, Ms. Ferguson. I mean, you are, in your department and all of your social services staff are, you know, right now just combing through a ton of information and pivoting to work that you didn't contemplate, you know, a month ago. But we also know that going forward, as COVID cases come down, as we start to get a health control handle on this, your work is going to continue because people will have to be dealing with the effects of this for a long time. So I thank you now, you and your staff, for the work you're doing now, but I'm well aware that you will continue to be, you know, in the firing line in the months to come. So courage. Thank you.
Thank you.
Okay. Mr. Boileau, welcome.
Thank you. Good evening. I was just thinking, sitting back there, that you've been listening to a whole lot of information for about 2 hours without any reports in front of you. So there's a whole lot, this is a lot of information for all of council. I have 4 general areas, and I just want to speak briefly on each of them to give you an idea of what each department is doing. In the planning area, a bit similar to the economic development area, and to the point that that you just made, Madam Mayor, there is in fact a lot of activity that is occurring both with planning and economic development. A lot of preparation for the days that are back to the normal days. So a lot of people are making applications, interestingly, for those days that are coming. And so I would suggest that, especially with the planning department and certainly also with the building department, they're seeing inquiries and they're trying to do that work either remotely or online. So they're quite busy for the days when we can open up the doors again and behave normally. So in the planning department, they're responding to inquiries on site plans, on committee of adjustment applications. We are currently reviewing our entire zoning bylaw, which is a lot of work. We're working with the consultants on that item. In fact, have a meeting with them tomorrow. We're doing work orders, etc. So they are working, that department, the planning department, are working a little bit of a balance between remote working and in the office. Again, trying to have proper separation between people and, when possible, working remotely and fairly effectively, I might add. Economic development, trying to assist businesses. You may be aware, I think, with some of the efforts of the Chamber of Commerce and their website, in addition to a small and medium-sized business initiative that is also online, trying to assist other businesses with certificates, purchasing, etc. So those are a couple of things that they've been working on. Communicating with businesses, I think many of you would be following what's on our website, the Economic Development website, and it's a daily, I think quite well done, daily source of information for businesses and what you can do, what you can't do, and where can we help. By the way, on that, our activity on that website is 5 times what it normally is. So it gives you an idea of, I mean, people are expecting to work on their devices, and that's what they're doing. I think it's also important to mention that the manufacturing sector, a little bit to my surprise, is entirely happening in the community. There have been very few restrictions on manufacturing, I suppose for good economic reasons, but that is, as Glen Tapp pointed out, it's still a very, very busy place. So with the exception of one facility that is selected to take 2 weeks off, a major employer in the community, but all of the balance are still, of course, we're in the distribution business as well, so you know, you can imagine that they have to continue, in fact are an essential service anyway. Tourism, continue to communicate with the MAT applications, trying to assist with that. In fact, there was a media release today talking about a couple of successful applications. Things like hotels, restaurants, retail are obviously very strongly impacted, and they're always looking for a bit of communication from the office of what can they do, what can we now look forward to. The Enterprise Center, similarly working with the potential small businesses as well. There are 52 starter company applications. We've never had that many starter applications. So that's a very good, very good. It's a considerable increase from what we normally see. And then of course, the department is working weekly, or on calls weekly with surrounding municipalities, trying to understand what's happening in SD&G, in Prescott Russell, in Ottawa, Kingston, etc. The building and bylaws section, with buildings, it was interesting when we actually shut the building down that we got a fair number of inquiries from developers who were looking to just continue, and as we know, there is still a fair amount of construction that certainly was happening earlier and still happening to some extent now, a little bit more restricted, especially on the residential side. But the requests for applications continue, and I think what's important there as well is, even though there are restrictions, there is nothing stopping someone from making application for a permit, so that again, when things become normal, they're ready to go. So we're still seeing applications for example, a single-family home, a semi-detached, etc. Even though you can't build it right now, the applications are being submitted. Building officials are working remotely, a bit of a balance of having to come into the office, but are actually doing their inspections virtually. So this takes longer, but it provides a service that I think the community appreciates. Sorry, I'm just, the intake of all applications continue, as I indicated. And I think a fair amount of information has been provided to everyone about what can occur. That list that is put out by the province is really the guide for us as well, and it's very helpful. It is a little bit more restrictive, but is still keeping the department very busy. The bylaw side, we are normally 5 people in the bylaw section. We are down to 4 because of one illness that is unrelated to this. We are not issuing any parking tickets, with the exception, of course, of violations, people parking in fire lanes, hydrants, those types of things that, and complaints of people parking where they shouldn't be parking. While you hope that the activity out there is down, there is still a fair amount of activity, and unfortunately, it's surprising how many vehicles are improperly parked. So the activity, we hope to be lowered, and so those violations lessen. As the police chief pointed out, fairly recently, our bylaw officers have been allowed to assist with the infractions, the COVID infractions, so the emergency activity that is happening. So they're trying to assist them. For example, groups of 5 or more, business restrictions, playground equipment in the parks, which has been talked about. So not only are they trying to do this, but also they need some training on all of that. I have to say that I think they had some questions and concerns about doing that because it was unusual to them. But I think we had some communication with the police chief and his staff on this, so I think our bylaw officers are happy to do this now that they know what they're doing, and so that's an asset to the police department as well. They're also patrolling the trails and the parks, both by foot, bicycle, etc., just trying to get out there and making sure that our playground equipment is not occupied. Park benches as described, picnic tables, and so on. So there's a lot of work to be done. And then, of course, there are all of the normal things that occur: animal control, general bylaw complaints, business licenses, and so on. So it's a lot for 4 people to try to do things that are the norm, and also trying to assist in other ways as well. There was a question about the gazebo. I can't recall who was asking that question.
Councillor Bennett?
And the answer is yes, it is. It should not be occupied. And it should not be occupied for a couple of reasons. One is because of what we're going through, but also it's a fairly common place for people to smoke. That cannot continue, and so we'll be enforcing both of those. Finally, in the recreation and facilities area, as you all know, our buildings have been closed to the public. So namely, that is very much the Aquatic Center, the Civic Complex, the Benson Center. Staff are continually sanitizing at various locations. Some of the buildings, especially the Benson Center, continues to be occupied by staff. And so there is a fair amount of sanitizing required there. Of course, these buildings are also, some of our buildings need proper cleaning, sanitation, etc. We're trying to prepare the facilities as well. Again, like the building permits, there's going to be a day where people are going to expect to be able to use these facilities, all of these facilities. So even including things like pools and tennis courts and ball fields. When the day comes when those are available to the public will not be tolerant of us telling them that we're going to be a while to get these things fixed up. So we're trying to deal with that now for the day when those activities can happen. A couple of other items: the recreation master plan that is out there right now, trying to get some public input, and so the consultants are working on that. On a similar vein, the Arts Center, the architects are hired, trying to get some public input. That will start soon. The architects are also able to do some of the preliminary work, site inspection, geotech requirements, all of those early requirements. Capital Works, we're doing Capital Works where we're meeting the provincial list. And that is largely to allow for preparation for public use, where safety is a concern. So, for example, at King George Park, you'll recall that we need to replace the poles and the lights and the netting and those types of things. These are items that there is literally, as described earlier, when we came to you as a capital project, the poles are rotting. It's a dangerous situation. So that is something that you can't just leave. And then, of course, the other matter is that there has to be proper physical separation. In other words, if a capital project requires that cannot occur, we don't have that project ongoing. Those are my comments, and I'd be happy to answer any questions.
So in the room, comments, questions? On the phone lines, Councillor Bergeron?
No questions.
Councillor Dupel?
Councillor DePaul is good, thank you.
Councillor Gardner?
Yeah, Mark, can you, as much as you can say, how are we doing with the EMS roof? Is that being repaired, or where are we with that? And I'm not talking about, I'm talking about just the construction of the roof, period.
I'm sorry, I don't have the answer to that. I can get the answer for you, either through Mr. DeWitt or Neil Dixon, and I will do that. I'm not sure if any in the room has any idea of how that's proceeding, but I don't.
I'll just turn to Madam CAO.
Thank you, Madam Mayor. So at this point in time, we don't have information on that for an update for you, Councillor Gardner, so we'll provide more information.
And the other, I guess, Mark, you might be able to answer this. You talked about Boileau and the police working together to make sure the orders that are put forward by Dr. Paul and the province are adhered to. Are the health unit inspectors also involved in making sure that the orders are followed?
Yes, they are.
Yes.
Thank you. No more questions. Thanks.
Councillor Grant?
I'm good.
Okay. I don't think Councillor Towndale's around. No. So, Mr. Boileau, your staff has had to pivot remarkably here under these circumstances, and it's great to see how game everybody has been to do that. The Choose Cornwall website has terrific information, and I know that local businesses are really pleased because they are suffering. We know that. I like to hear you say that they're turning their minds to what happens next and planning for the future, but in the meantime, they need help now, and a lot of resources have been put on the Choose Cornwall website, and I'm glad to hear that there's so much traffic there. I'm glad to know that the City of Cornwall is also supporting the Chamber in their projects to support local business, supporting Kelly Bergeron's gift certificate program as well, so trying to support a diversity of things for local businesses. So it's not just individuals, but businesses themselves that are struggling. So I'm very happy to see how your department has been able to pivot and respond to a whole set of new needs while carrying on business as usual. Merci. Okay. Madam CFO. Last but not least, right? Yes.
Good evening. Our first update is regarding the deferral of the collection of property taxes. So at the March 20th special council meeting, council approved the deferral of interim tax due dates and postponed interest charges for homeowners and businesses in our community. So property taxes that were due at March 31st and April 30th were deferred to May 15th and June 15th respectively. To April 1st, just under 5,000 properties deferred their payment. This totals approximately $6 million in taxes not paid at due date. Following the next due date of April 30th, we will provide council with a further update for this deferral program. Deferral of education property tax remittances. As council is aware, Ontario municipalities levy and collect education taxes for the province and remit the amount collected to school boards in their area. The City of Cornwall collects approximately $16 million per year and remits to 4 local school boards quarterly, March, June, September, and December, approximately $4 million per quarter. The Minister of Finance has announced the deferral of the upcoming June municipal remittance, as well as the deferral of the September quarterly remittance by 90 days, which means the city will remit June payment in September and the September payment in December. This will assist the city in its cash flow in the fall. And to ensure this deferral does not have a financial impact on school boards, the province is adjusting its payment to school boards to offset the deferral. The 2020 assessment update. The Ontario government has announced the 2020 assessment update has been postponed. They have indicated that property assessments for the 2021 property tax year will continue to be based on the fully phased-in January 1st, 2016 current values. This means that the property assessment for 2021 taxation year will be the same as the 2020 taxation year, unless there have been changes to a property. The COVID-19 financial impact. We are reviewing how the COVID-19 crisis will impact the 2020 budget. With recreation facilities closed, the city has seen a loss in revenue and user fees. To offset, we're expecting to see a decrease in related operating costs, utility, water, etc.
Just let me interrupt you. So the people on the phone, make sure that your phone lines are muted. We can hear conversations, and you probably don't want us to be able to hear those. Madam CFO.
As Mr. Tapp indicated, transit fare revenue is down. We are not collecting transit fare, though the city has reduced costs related in fuel. The city may see an increase in expenses related to PPEs and other supplies such as cleaning. Some of these costs will be funded through the money the province has allocated through the Social Services Benefits Fund. And municipal associations are also lobbying the provincial government for other financial support. So not knowing how long this emergency may continue, it is too early to understand the full financial impact to the 2020 budget. Department managers will continue to monitor, and we will report back to council. Financial services itself, staff are at work. It's regular business for us for accounts payable, accounts receivable, purchasing. We continue to issue tenders, RFPs, POs, etc. They're reviewed with the CAO and approved based on her delegation of authority through council. ITT services staff are working remotely and on site where needed.
Questions in the room? Councillor McIntosh.
You say you're not aware of the full impact, but there is definitely going to be an impact,
There will be an impact.
Yes.
which will have to, at budget time, could put a strain on services.
We will have to see
Yeah.
how long this continues, and that will determine financially what will the impact will be.
The taxes were deferred to May and April instead of March,
Yes, so the taxes that were to be collected.
May and June.
The taxes that were to be collected March 31st were deferred to May 15th, and the taxes that were due April 30th are deferred to June 15th.
At this point, it's a pretty good guess that you're going to come back to council and say that the deferred has to be deferred again, because if somebody hasn't collected a dime in their business, they're not in any position to pay any more than they were a month and a half ago.
That is possible, but we'll have to see how long this event lasts, and that will determine what our recommendation would be to council.
Yeah, okay. There's a federal plan to help businesses that keep people on the payroll. It's up to 75% now. Could we be eligible for any of that?
I would have to defer that question to Mr. Clarke, but I don't think so.
Mr. Clarke.
Thank you, and we do not believe we're eligible for it.
Thank you. Councillor Hollingsworth?
Perhaps as much of a comment, maybe a question then a comment. Our general working reserves, do we use those for this potential circumstance?
Whoever's talking, would you speak into the mic, please? It's hard to hear you.
Councillor Hollingsworth?
I'm just about to
Lean
speak.
in, lean in.
This work
That's
for you,
better.
Madam?
Wow,
Yes.
that's amazing.
Just trying to help. So that being said, our general working reserves, is this the kind of thing we use them for?
We would go to our general working reserves if the city was in a deficit at the end of the year. So if we could not find other sources of revenue, other funding from government to support any lost revenue or additional expenses, we may have to go to our general reserves.
That being said, Your Worship, I'm generally not a fan of that kind of thing, but I think circumstances being what they are. The other thing that I guess as a prequel to budget next year, I'm not a champion of cutting capital budgets, but this might be the year where, when you're sitting down with your senior management staff, this might be the year where it really has to be just what we need. We'll see. Just a comment. Thank you.
Anybody else in the room? Councillor Bergeron?
I have a question on procedure, I suppose. Has it ever happened where council came back and redid a budget during the year, or are we bound for the year? Quick follow-up would be, if we do kind of reconvene in June or July and look at our 2020 budget, would it require 6 councillors to make any change?
Madam CAO?
Thank you, Madam Mayor. So we've not been in this circumstance before, but we have been in previous years in circumstances where we've had significant costs, primarily I'm going to say from a winter control perspective and other things that have maybe thrown our budget a little bit off, and we've trended for a fairly significant deficit. So if that were the case in this year's budget, what would end up happening is staff will bring back it will likely be a second quarter report or a third quarter report. What we would do is we would also come back to council and identify items that we have not yet started with respect to expenditures, projects, and we'd probably come back with a list of items for council's consideration to defer to a future year or perhaps not do it all. So that would be the approach that I would recommend. Right now it's a little bit too early to assess, but I want council to understand, we're also very sensitive understanding, economically the impacts that are currently being felt within our community. So the type of work that's going on right now within the city and the items that we're moving forward with are I'm going to say part of our asset management plan, our day-to-day stuff that we do every year to maintain our infrastructure. Those are the projects right now that are still proceeding.
Councillor Bergeron?
Yes, that's a fair answer. Thank you.
Thank you. Councillor Duppel?
I'm good, thank you, Madam Mayor.
Councillor Gardner?
I'm good, thank you.
Councillor Grant?
Thank you, Madam Mayor. I'm on the same wavelength as Councillor Hollingsworth. I think we seriously have to look at our capital budget and see if there are projects that we can defer till next year or the year after. It's going to be a tough year, and I think we have to look at that. And these are exceptional times, so we have to look at exceptions.
Thank you, Councillor Grant. Ms. Bailey? And Madam CAO, you should all know, everyone in the room, everyone in the community, that these two women put in long hours. And I've been able to observe that personally. And I want to thank you, Ms. Bailey, for always going above and beyond on this file. She just handled year-end in the midst of a pandemic, and her and her staff were really taking care of business as usual. So I certainly feel that we're in good hands, and it's with great confidence that I say that to the community as well. Thank you. Madam CAO, you may want to comment on what another meeting might look like, or what we might be able to use in terms of technology, how we'll move forward next.
Certainly, thank you, Madam Mayor. So the clerk, as well as our General Manager of Corporate Services, have been looking at certainly trying to come up with another tool to support electronic participation. So we do have information from eScribe, our provider of our software, to do Zoom meetings. So we have got that, I think, lined up. We do believe that there's a little bit of testing that will have to take place, but I think our hopes and expectations would be for our next meeting, depending on how quickly it was called, we might be able to do it via Zoom, which I think would make it easier for those electronically to participate. I think I would just like to look over to the clerk to see if she wanted to add any comments to that.
Madam Clerk?
Thank you, but I think the CAO has summed up where we're heading.
Perfect. Okay. Thank you. Councillor Hollingsworth had a question, Madam CAO.
Just a comment, Your Worship. The other day, our school did kind of a web-based thing where we used a Microsoft Teams. And quite frankly, we've dabbled with a few other ones, and I thought that one has worked the best in terms of gaining access and being able to communicate. It really went pretty well for a guy who's about as techie as the caveman. So if I can operate out of it, just about any human being can. Probably a 2-year-old could fire it up. It might be something worth considering for future reference.
Any comment there?
Thank you, and I've heard comments from others that have used that as well. Part of what we'd like to try and do is have a solution that works with our webcasting, so that the webcasting still takes place and everybody in the public is still able to watch our meetings. So we're trying to come up with a balance of a solution that works well with our existing webcasting service.
May I remind you, Councillor Hollingsworth, that you and I and the CAO are exactly the same age. So whenever you refer to yourself as a caveman, I suspect the CAO, we might take that personally.
It's simply from a technological perspective,
okay,
Your Worship.
okay, I just wanted to...
Old school, I made paper for a living.
Just wanted to highlight that. Before I call for adjournment, I wonder if Madam CAO would want to just make a comment about her leadership team.
Thank you, Madam Mayor. So
I would also like to make a few comments before you adjourn, Madam Mayor.
Okay, well, why don't we go ahead, Councillor Gardner, and then I'll go to Madam CAO.
Well, first of all, before you adjourn, I want to just congratulate our administration, our support staff for the incredible job you folks have been doing under this stressful times, and also wish Councillor Towndale the best in his deployment, and for him to keep safe, and for everybody else to keep safe. Thank you.
Thank you very much, Councillor Gardner.
Madam Mayor, if I may, Councillor Tapp, I'd like to say
ahead.
a few words as well.
Go ahead.
I've sent some emails out to you, Madam Mayor, and to Madam CEO regarding the management team.
You have.
I just want to say that the communication has been 100% to the residents of Cornwall, to council, and I'm very pleased to serve under your leadership, Madam Mayor, as a councillor for the city of Cornwall, and I've expressed the same appreciation to Madam CAO, and along with the management team. I think everybody has done a great job in this difficult times, and I'm very pleased to be part of this team.
Hear, hear. Thank you very much for that. Anybody else? Councillor McIntosh.
I was planning to make a motion, but I'm not going to make it. I'm just going to read it. And, that we stand behind the administration led by Maureen and your leadership, Miss Mayor, and the Dr. Paul's contribution to all of this. I think the communications have been great. I've heard nothing but, I haven't heard one negative thing out there. Not that I'm talking to everybody in the city, but it's been great, and I really admire the leadership we're getting on this. Really good job. The whole team, from top to bottom.
Thank you very much. Anybody else? Councillor Bennett?
I also kind of wanted to say something very similar to that is, the info I think that I've been getting, and I'm sure all of us are getting, is good, is timely. You all know what I do for a living. I see a lot of people in a day, and I feel like when I'm being asked a question, I can answer it. And I think when you consider how fast things are changing with this, hourly, that we're getting this information, the time that we're getting, I think is very, very much appreciated, especially, like I said, for myself that's in the public, working with the public, like to the tune of like 1,500 to 2,000 people a day through my door. I get some questions, and I have no problem answering them, and that's all because of the information I'm getting in the manner I'm getting it. So thank you very much for you and your team for all that.
Thank you. Anybody else?
Well, just know that I agree with everything that's been said.
I heard your hallelujah there, Councillor McDonald. Thank you. Anyone else? Councillor Ibarra?
I'll throw my ditto in there.
Sure.
But I feel like your leadership, Madam Mayor, the way you compose yourself in your videos, that I think the community really appreciate, your confidence and like your composure. You are not expressing fear. You're calm and you're confident in your team, and that's resonating across the community. And I know that I have full confidence in you and the team, and know that you can lean on us. And I know that that all of you have taken on, the management team and yourself have taken on a huge responsibility here, and that you can lean on us a little bit more need be going forward. And I'm grateful for all the communication, but if there's any way we can step in and support, please know that we are here for that as well.
Thank you for that. I want to say, each and every one of you, every single councillor, all 10 of you, have reached out to offer help, to ask about my parents, to ask how I'm doing, and I appreciate that. I don't feel alone in this process at all. And I know that you are connected to your networks. I know that because I hear from your networks, all 10 of you, and I know that you're out there doing your job around the messaging, around the staying at home piece, around making sure that people are getting answers to all of their questions. So to all 10 of you, merci. I don't feel alone at all. And confident? Absolutely. Thank you. All right. Madam CAO.
Thank you, Madam Mayor. I would like to make a couple of brief comments. The senior team certainly has been working hard and excellent to work with through this process. I think we do absolutely feel that we have the 100% support and backing of the Mayor and all of Council. So we absolutely appreciate the support, and we know that we have it. Behind our senior team, though, we have a network of a lot of employees in this corporation. We also have the support of the heads of our unions, and
Yes.
I've never seen a group come together like the group that we have. It doesn't matter what we need to respond to. Everybody is working for the same goal. We want to work for the health and safety of our employees, as well as the residents of the lodge, the people in the community that need our services. So everybody has really chipped in. It has been excellent. I can't be prouder. So thank you to everybody. I'm a little emotional. I know that
Okay,
would
that's
be.
fine.
But everybody has been exceptional.
Thank you for that. And thank you for the emotion. I think it's legitimate. And, when you look around, if you look at what's going on in other cities, we are doing really well in terms of communication and leadership. And thank you for mentioning the unions. Everybody has just stepped up and been their best selves. So, on that note, I want to just send a message out to the community. Because speaking of being our best selves, the community is too. It's exceptional the way people have chipped in to form all kinds of networks to help people out and to make sure that people are staying connected. So thank you to the community. I want to wish everybody a happy Easter. And I know Passover starts sundown tomorrow. And I want to, again, repeat that I know it's family time, but we need to stay home. We need to follow the rules, because that's what's going to help us continue on this flattening of the curve. So I'm imploring people. Alors, restez chez vous. C'est le temps pour nous de rester ensemble en restant à part l'un de l'autre. C'est difficile, mais le plus qu'on va rester à part, le plus vite qu'on va pouvoir se rassembler en personne. So, the more we stay apart now, the quicker this is going to end for all of us. On the issue of your elected officials, I just want to say, your MP and your MPP have also been fantastic, organizing meetings, keeping us informed. I'm meeting with the counties tomorrow. They too are doing their part. And I would like to just mention Dr. Paul here. Dr. Paul has been absolutely stellar in terms of staying in touch with us. He is aware of our issues. He knows that Cornwall needs particular messaging. There's this thought that there's a lot of cases in Prescott-Russell and not here. It's not true. So he understands that Cornwall needs special messaging. He's working on that. He's working well. He praises the city of Cornwall and all of the staff as well, Madam CAO. And so it's really been a good relationship. He's also looking into the issue of all the Quebec plates that have been seen in our store parking lots. So he is looking at that as a priority. You know that stores in Quebec are closed on Sundays, and that has created some additional traffic. We are concerned going into Easter weekend as well around extra shopping in our stores. So Dr. Paul is on that. I just want to let you know. He's working with the MPP. We're putting pressure on the province to maybe consider making some changes around that. So just so you know, it's a constantly evolving file, and all of your elected officials in this community are up to the task. So on that note, merci beaucoup. I'm going to call for a motion to adjourn and wish you all well. Stay home, stay safe, stay connected, save lives. Motion to adjourn.
Hey, Madam Mayor, I want to wish everybody a happy Easter and to keep Jesus in mind. And you too.
Thank you, Councillor Grant. Do you want to make a
I'll
motion
make the motion to adjourn.
Okay. Seconded by? Councillor Hébert, all in favor? Carried. Merci.
Favor.
Take care, everybody.
Favor. Take care. All right.
Madam, I just want you to know that John Tory declared today that the Easter Bunny is an essential service.
Easter Bunny is essential, yes.
Has left the conference.
Councillor Grant.
Has left the conference.